larynx sits on the throat at the point where the airway and esophagus diverge. The true vocal folds, also called the vocal cords, are the V-shaped structure within the larynx responsible for the majority of larynx function. Unlike the esophagus, the true vocal folds have a very delicate epithelium, which is very sensitive to damage from corrosive stomach contents. At the cellular level, they have an epithelial cell layer, 2 layers of a jelly-like material called the lamina propria, followed by the vocal ligament and vocalis muscle. Acid from the stomach sometimes refluxes into the esophagus. If the acid goes all the way up to the esophagus, it can spill over and affect the larynx, including the vocal cords. The chemical makeup of gastric acid comes from a combination of hydrochloric acid, potassium chloride, sodium chloride, and a powerful proteolytic enzyme called pepsin. As the gastric acid covers the epithelium, the delicate squamous cells are injured by the powerful acid and enzymes. This causes the surrounding tissue to become inflamed. If the vocal cords are repeatedly damaged from gastric acid, it often leads to edema and chronic inflammation as the tissues try to recover from the injuries. This can cause hoarseness, vocal fold lesions such as granulomas, and in severe cases, even cause trouble breathing. The best way to evaluate for acid damage to the larynx is to see a throat specialist or an otolaryngologist.